Welcome to WxTV, your online source for weatherization training. This episode marks the first of our health and safety series. Now, many of us may picture certain things when we think of health and safety films.
Health and safety. It's a part of our daily lives. We rely on safety regulations to prevent our homes from burning down each morning when we make a piece of toast.
But this series will be different. We'll focus on the science of safety. Recommendations and regulations from groups like OSHA, EPA, and DOE are based on decades of research. They prevent accidents in the workplace, but more importantly, they prevent us from harming the clients we work for, or worse yet, bringing those hazards home to our own families. Safety is determined by the practices we choose as workers, but there are entities that regulate and watch over those practices. The Occupational Safety and Health Administration, or OSHA for instance, is concerned specifically with worker safety. They regulate such things as ladder safety, fall protection, personal protective equipment or PPE, respiratory protection, fire protection, electrical safety, power hand tools, confined spaces, and motor vehicles. We'll cover several of these in depth in upcoming episodes. In addition to your own safety, there's another consideration: health and safety of the client. There could be pre-existing safety hazards inside the home, or the work you do could create a hazard for that client. Groups like the Environmental Protection Agency and the Department of Energy have come up with rules, standards, and recommendations that help us work with and prevent any health hazards that exist in a client's home. Funding for health and safety measures has been a part of the DOE Weatherization program since 1993. Lead is a poison. The primary concern for weatherization workers and clients is the use of lead in paints and varnishes for homes built prior to 1978. When disturbed, dust from these paints can be inhaled or ingested, leading to serious ailments associated with the central nervous system. Lead paint dust is especially dangerous for children and pregnant women. Asbestos can be extremely hazardous. It was used in many different types of building materials, including loose-fill insulations like vermiculite, sometimes used for attic spaces. Working around asbestos, whether it's for testing or minor removal, requires specialized training and the right personal protective equipment. As the weatherization program has advanced, homes are being tightened more than ever before. In keeping with the house as a system approach to weatherization, we know that tightening a home can affect the way combustion appliances operate. Poorly functioning combustion appliances can produce lethal amounts of carbon monoxide. Program standards include steps for assessing the health and safety of these appliances before and after weatherization measures to ensure they are getting enough air and not producing excess levels of carbon monoxide. Electrical safety and weatherization comes down to two issues: overheating and overloading. Retrofitting thermal insulation around old electric wiring, primarily knob and tube wiring, can cause it to overheat, resulting in a fire hazard. States must ensure that insulation around wiring conforms to national and local codes. Additionally, weatherization measures that involve the installation of new electrical equipment can bring previously marginal overload problems to hazardous levels. Molds are part of the natural environment, and their spores are present in every home. They have the potential to cause health problems in individuals who are sensitive to the spores or in individuals who have asthma. The weatherization program is not a mold remediation program, but DOE funds can be used to correct energy-related conditions such as bathroom fans that can help to reduce mold and moisture problems in a home. Radon is a radioactive gas that results from the decay of naturally occurring radium in the Earth's crust. Now, it can become a problem if the gases build up inside a home, leading to various health issues for the occupant. Now, the radon abatement systems, like the one that you see here, are not an allowable health and safety expense under the weatherization program. But crews need to be made aware of radon problems that exist in a home because some of the weatherization measures that they may install could exacerbate the problem. Volatile organic compounds, or VOCs, are chemicals that give off vapors at room temperatures. Many of the caulks, adhesives, and paints that we use in weatherization contain VOCs, as well as manufactured woods, carpeting, and even cleaning supplies found in a home. Because of the potential for adverse health effects, crews should be cautious when selecting products for weatherization, as well as when selecting air tightness limits in dwellings with VOC problems to begin with. Other health and safety issues you'll want to consider include the biologicals, things like spiders, snakes, scorpions, mice that can carry hantavirus. These are all considerations when your crews are entering things like crawl spaces and attics. Building rehab is beyond the scope of the weatherization program, but crews will frequently encounter homes in poor structural condition. Major structural problems that present a health and safety issue to crews or occupants may require deferral. Some minor repairs may be performed with weatherization funds if those repairs are necessary for effective performance or preservation of weatherization materials. A good example of this may be repairing a minor roof leak to preserve new attic insulation. For some agencies, changing out inefficient refrigerators and air conditioning units is a common practice. The refrigerants found in these units can pose a substantial environmental health and safety hazard. States must have protocols in place to comply with EPA standards regarding the maintenance, service, repair, and disposal of appliances containing refrigerants. Spray polyurethane foams used for insulating and air sealing measures in weatherization contain isocyanates and other harmful chemicals that can lead to respiratory distress, skin and eye irritation, or other harmful health effects in both clients and workers. Best practices guidelines and guidance have been set by EPA, OSHA, and NIOSH regarding the use of spray polyurethanes. Some client and worker health conditions can be exacerbated by weatherization work. Agencies must have procedures in place to identify pre-existing health problems and ensure that work won't worsen those problems. If you find yourself in a situation where a client or a client's pet is hostile or threatening, get out. You're here to weatherize a home. For additional information regarding any of the topics you've seen here, check out WxTV.org. Just follow the drop-down menu under Technical Tools and choose Health and Safety. Well, that's just about it for another episode of WxTV. But one last thing, when it comes to health and safety, don't take chances. The decision to defer work, or in extreme cases, to provide no weatherization services at all, can be difficult, but it also may be necessary. If you're in question about this, contact your state monitors and your managers. They know the proper protocol and procedures. And hey, thanks for watching. Some client and worker health conditions can be exacerbated by weatherization work. Agencies must have procedures in place to identify pre-existing health conditions and ensure that work won't exacerbate those problems further. WxTV, your online source for weatherization information, techniques, and expert advice.